Hi, so I'm going to be discussing the functional anatomical study of psychogenic amnesia that was conducted in 2000 by Fumihiko Yasuno and colleagues. So it starts out with the introduction where it gives a background of psychogenic amnesia, which is an inability to recall information already stored in the patient's memory, usually related to a stressful or traumatic event, and it cannot be explained by manifest brain damage. So the neuronal mechanism that underlies psychogenic amnesia is questionable. Previous studies have measured PET blood flow in patients experiencing retrograde amnesia, so the study did just that. They focused on a psychogenic amnesic patient who experienced retrograde amnesia following a stressful event with no evidence of brain damage in hopes of confirming some of the statements in previous studies. As for the methods, the patient was a 33-year-old female who complained of having lost her memory. She had been dealing with a lot, and she tried to commit suicide by overdosing on hypnotic drugs, and she was admitted to the hospital. When she regained her consciousness, she had lost all of her long-term memory, including her own name and her identity. So a CT and an MRI scan were done. They revealed no abnormalities. She was alert, attentive, and oriented, and all neurological parameters were normal except for her persistent memory disturbance. So the PET study was an activation study that was performed on the patient 2 months after the onset and 12 months after the onset. They did it 12 months after just to assess the functional modifications associated with recovering. The same task that the patient completed was completed by a group of neurotypical control subjects. They consisted of 12 men with a mean age of 26.1 years. So as for the actual experiment, the participant watched a monochrome television 75 centimeters from their face, and each presentation consisted of serial presentations of faces with an exposure period of 3 seconds per face. So when they were looking at these faces, they had to complete 2 tasks. One of them was gender classification, so they had to decide if faces were male or female by lifting the right index finger if it was female, and the famous face identification where they would lift their left index finger if the person were a politician. So out of all the faces that were shown, 28 were male, 7 were female, 35 famous male faces were shown. So as for the way that they were exhibited, the tasks were administered in ABBA design, and 4 scans were completed for each task. So the order of the conditions was the same between the acute phase and the recovery phase for the patient, but it was counterbalanced across the neurotypical control subjects. So as for the results, in the first PET study, the patient correctly responded to 93% of the total stimuli in the gender classification task and 84% of the total stimuli in the famous face identification task. After the study, the patient did comment that even if she could recognize the famous face, she didn't have confidence in her judgment. She couldn't really explain how she knew that the faces were famous. So in the second PET study of the patient, she correctly responded to 95% of the total stimuli in the gender classification task and 97% of the total stimuli in the famous face identification task. So as for the results for the control group, they are listed in the table in the figure above. So as you can see, for the control subjects, there is a direct comparison of the famous face identification and gender classification task. It showed increased activation in the left medial and middle to inferior lateral prefrontal cortex, the left occipital cortex, the left caudae putamen, the right anterior cingulate cortex, the right cerebellum, and the bilateral hippocampal region. Activity was generally decreased in the left superior and bilateral inferior parietal cortex, the right middle lateral prefrontal cortex, and the right inferior temporal cortex. And their brain scans are shown on the right. As for the patient, there was a bit more to go in. There was the acute phase and recovery. So 2 months after the onset, the direct comparison of the famous face identification task and control task revealed increased activation in the left anterior cingulate cortex, the left caudae and putamen, the right medial prefrontal cortex, the bilateral occipital cortex, and the right anterior medial temporal region, including the amygdala. Activity was decreased in the left superior temporal cortex, the right inferior parietal cortex, and the right hippocampal region. So during the recoveries, 12 months after the onset, the comparison of tasks revealed an increased activation in the left temporo-occipital junction, the left anterior cingulate cortex, the left cerebellum, the right medial and inferior lateral prefrontal cortex, the middle temporal cortex, and the right hippocampal region, as well as decreased activation in the right middle lateral prefrontal cortex. So with all of those brain areas and all of those names and all that information, the study was able to deduce that additive activated areas reflected increased cognitive demand in the famous face identification task when compared to the control task. So it was a bit harder. The right hippocampal region, they found, may be associated with the relatively automatic aspects of face processing and this passive component of memory processing functions, even when one is not trying to remember the material. So this could explain why the patient was able to score pretty well despite her psychogenic amnesia, but as she said, she didn't really have the confidence. So this was possibly her right hippocampal region doing the work for her. So there was decreased activity in the right middle lateral prefrontal, inferior temporal, and left superior parietal region. That might be related to a decreased attentive or visual spatial demands in famous identification tasks when compared with the baseline task. So they also found that the difference in activated areas between patient and control subjects in the famous identification task seemed to indicate that psychogenic amnesic patients activated different brain regions from those of control subjects when trying to retrieve memories. So the activated areas of the patient indicated functional abnormality despite the presence of brain damage. So the abnormalities of these regions are going to be discussed. So the bilateral hippocampal region, the activation in the bilateral hippocampal region of the patient was different from the control subjects. So during the acute phase, the activity of the left hippocampus region did not change, and decreased activity was found in the right hippocampal region. During recovery, activation became increased on the right side, but no activity was evident in the left side, so it was kind of flipped. So the right hippocampal region has a role in automatic aspect of face processing, and the left is more concerned with explicitly judgments related to the identity of faces. So the patient during the acute phase, 2 months after, had abnormal implicit and explicit aspects of memory processing of a face that was recognized from the past. But during recovery, 12 months later, she could still perform the automatic aspects of the task, but she had problems with the explicit judgments. As for the anterior medial temporal region, the activation of the anterior medial temporal region was increased in the patient only in the acute phase, so after the 2-month period. They speculated that the patient had an abnormality in the expression of emotional contents induced from facial stimuli recognized in the past. So results suggest that this abnormality was involved in the generation of symptoms in the patient. So the increased activation of the left lateral prefrontal region in control subjects was not, but not the patient. It was not in the patient. And that was associated with some aspects of semantic retrieval processes, such as strategic search. And the patient had difficulties in retrieving semantic aspects of a stimulus that had been recognized in the past. So the patient activated different brain regions from those seen in neurotypical control subjects while making explicit memory judgments about facial stimuli received in the past. And the lack of activation in the hippocampal region might relate to an abnormality in the implicit and explicit components of famous face judgment task. And the hyperactivity of the anterior medial temporal region, including the amygdala, which processes a lot of emotion, might relate to a functional abnormality in the expression of emotional contents induced by receiving past events. So the lack of activation in the left lateral prefrontal region, it might reflect difficulties in retrieving semantic aspects of stimuli recognized in the past, and it may be associated with sociopolitical context. And the abnormal function of the amygdala influences information processing, subverts in other limbic regions, including the hippocampal region and the anterior cingulate cortex, which are involved with memory. So this study basically said that because of these abnormalities and the relation between them, it may add to the symptoms of psychogenic amnesia. So it could possibly be because of the failure of these neurotypical brain functions in psychogenic amnesic patients that they have these symptoms of psychogenic amnesia. And that is it. Thank you so much for an amazing class and an amazing lab. Yeah.